Hi, my name is Catherine. This is my husband Bart and my daughter Francesca. Francesca was diagnosed with scoliosis when she was about 10 years old through a routine well check at her pediatrician's office. She was then referred to go to an orthopedist, who then in turn would monitor her through x-rays as she was getting older to see if her curve would get progressively worse. When she was about, I'm going to say maybe about 13, they showed that her curve was getting considerably worse, and they recommended that they put her in a hard brace. At the time, I was seeing a chiropractor for myself because I too have scoliosis, and I explained to him what they had told us about Francesca, and he told us about a new brace that is out from Scoliosis Systems with Dr. Deutschman and Dr. Lancia, and he explained that there are these elastic bands that are better for a child to wear instead of wearing a hard brace that constricts them. So we came, spine course, so we came down here to see Dr. Deutschman and proceeded to help Francesca with the treatment. So now Francesca's in the brace almost 2 years, and her spine has improved considerably, and she's able to wear clothes, normal clothes every day. Her friends don't even know she's in a brace. So if you want to talk about the brace a little bit.
Yeah, well, what was it like for you to come here the first time? What was that visit like?
Like when I first started out, it was like, I didn't want to do it at all, but then like I got into it, and then it helped me a lot, and I'm doing like a lot better now.
And what was the visit like that day? Well, was it a long day?
Yeah, it was really long.
What kind of things happened that day?
He took x-rays of me, and we did like exercises to see how my back was, and then put me in the brace.
Put you in the brace. Were any other exams done? Were there reflexes checked? Neurological exams? Did we look at your eye movements?
My eyes.
Yes.
We wanted to see like which way they were, like something like that.
Okay.
Neurological.
Yeah.
So you've been wearing this brace for about 2 years now.
Yeah.
Right. And has it been easy to hide under clothing?
Yeah.
Yeah. And most people don't know that you have it?
Yeah.
That's great. Anything you'd like to say to other girls that might be watching this out there your age?
That like the scoliosis system helped a lot, and it's definitely a lot better than the hard brace, and you could like wear it without anybody knowing. And
well, you can move better. You can,
yeah.
you can move, your movements are more free. You can. It's less constricting.
Yeah.
Do you do exercises also?
Yeah.
And how are they to do?
They're like pretty easy. Like once like you know what you're doing.
How much time a day would you say you put towards exercises?
Maybe like an hour.
Okay, great. And does that help you?
Yeah, it helps a lot.
Okay. Did you have any pain when you started?
No.
So you still have no pain?
Yeah.
That's great. All right. Is there anything else any of you'd like to say to parents that are watching this?
Well, I would recommend this type of a brace as opposed to a hard brace, because it makes the child feel better. It gives them better confidence. They don't have to wear clothes that are bigger or feel constricted with that hard brace. And this, to me, it works better.
You were telling us a little bit about a story where you brought the x-rays to your other doctor.
To the orthopedist, we did. As soon as she was fitted with spine cord, we went over to see him, I would say maybe after her 3 months of wearing it. Brought the x-rays to show him the brace, and he wasn't the least bit interested. He basically told us that he didn't care that she improved with this method, and she's no longer my patient, so I don't care. So it was very upsetting. Very upsetting that a doctor would feel that way, not to look for another alternative to help a patient, a child. So
Sure.
That bothered us.
Do you think a lot of doctors are like that?
I think a lot have tunnel vision, and they don't care to look at different avenues to help the patient. That's what they're there for. They're there to help.
And they're only inspired by whatever money they can get from the insurance companies that back them. That's it. We originally went to this doctor because of our insurance plan, and they wouldn't back it because of his diagnosis. We came here, Dr. Deutschman, and we paid out of our pocket because it's a better brace. We want the best for our daughter. We don't really particularly care for the politics.
Was it hard for you to make the decision to go against the orthopedist? to do something different than what
No,
they were saying was
absolutely not.
best?
Absolutely not. Because it wasn't making sense what he was showing with the hard
He
brace,
was rude.
as opposed to what you were showing us with this flexible brace. As far as the muscles were concerned, they were being constricted in this hard brace. And this one, she can move around and just be free. Like, nobody knows that she even has a brace on. None of her friends. Maybe one, her best friend knows, and that's it.
That's great.
Nobody knows.
Well, thank you so much for sharing all this. I'm sure it will help a lot of folks.
I hope so. Thank you.